All right, thank you, Nick. Well, along with the physical changes that occur as we get older, changes to our sleep patterns are a part of the normal aging process as well. Tim Bartos, President and CEO of Baptist Health Nursing and Rehabilitation Center, joins us now with more information about why you may not be getting the sleep you need. And I'm all for hearing about this one.
Oh, Liz.
I'm tired thinking about it, Tim.
There's nothing like a good night's sleep.
Yeah.
And did you know that over half of men and women over age 65 complain of at least one sleep problem?
Huh.
And as we age, it becomes more difficult to fall asleep at night.
Yeah.
We're less likely to fall into that deep sleep, or REM sleep as they call it, and we wake up more frequently during the night. Circadian rhythm, which controls our body temperature and our appetite, also affects our sleep. And for example, older people tend to fall asleep early in the evening and tend to wake up earlier in the morning than do younger people. How many older folks do we know that fall asleep in that very comfy easy chair right after dinner?
Oh, I'm sure that is appealing to a lot of people.
Yes.
How about snoring? What kind of role does that play in all
Well,
this?
that's a problem for about 90 million Americans, and snoring is most commonly associated with people who are overweight, and it does become worse as we get older. Now, loud snoring is particularly serious as it can be a symptom of sleep apnea and can be associated with high blood pressure and other health issues. Now, left untreated, sleep apnea can cause cardiovascular problems, headaches, memory loss, depression, you name it.
Yeah, and I'm sure for a lot of people it's a question of, okay, so my sleeping is off a little bit, but is it off enough to see a doctor? How do you know?
That's a good question.
Yeah.
Obviously, if you're up all night, there's no question you should see a doctor.
Yeah.
But any amount of insomnia, if it's bothering you, you need to see your doctor, because you and your doctor can assess how serious the problem is and what can be done about it. For instance, it might be as simple as cutting out some caffeine, or maybe taking less naps, or it might be a particular medication that's causing the problem. Oftentimes, behavioral therapy combined with prescription medications is what they will, is a very common treatment for this kind of thing. Or you can always resort to counting sheep, I guess, or grandma's warm milk, right?
Listen, I'm sure anybody will try anything that works.
Anything that works,
Thank
that's
you.
right. And remember, aging is mandatory. Getting old is not.
All right, thank you for that, Tim. And would you like more information about Baptist Health Nursing and Rehabilitation Center? Maybe you have, or Judson Meadows Assisted Living Community, or maybe you have a topic you'd like to suggest to 6 on Seniors. 370-4700, online, it's bapthealth.com.